This is my innovative solutions project. So, substance use disorder stigma is a big problem right now, especially because it's such a common disorder. And a lot of people with these disorders are commonly viewed in a negative manner and believed to be the sole cause and reason for these disorders, even though they're usually not. And commonly, a lot of healthcare workers who do treat them tend to give substandard care or are too fearful to admit them as patients because they believe they're just seeking drugs or will be violent. Solving public stigma on this issue starts with those who directly interact with the substance abuse disorder patients, like these healthcare workers, and getting those in need the help that they deserve before the stigma is even able to be reduced. So, the common design thinking steps are the empathetic approach, defining the problem, ideating, creating a prototype, and testing the prototype. Now, implementing these into my solution, for more of an empathetic approach, many people who have suffered through substance use disorders, they have faced these substandard cares and have been treated poorly, and a lot of their experiences kind of depict this of being treated poorly. And these examples help show the need for decreasing the stigma of healthcare workers against them. And a lot of these people didn't intend to become addicted that do have these disorders, and they have tried to get help, and it will hopefully show some people what they're facing and that they are just people and that they do need help and that they don't deserve the negative stigma that surrounds them. So, defining the problem that is facing substance use disorder patients and the stigma surrounding them is that a lot of individuals lack a knowledge or certification for dealing with substance use disorders as a whole. A lot of the local mental health services near me even there was a large lack of substance use disorder services on average. Some people just didn't even have it listed. So, ideating the solution, currently there is no requirement to have a certification or training on how to handle these substance use disorder patients, even though it's so common. And a required training or certification on substance use disorders would lead to a higher quality of care for those that are affected and understanding by the healthcare workers that allows for a reduction in the stigma, which would eventually spread to the general public. So, a possible prototype to this issue is that all healthcare workers would be required to undergo either something like a week-long training or a certification with handling substance use disorders and the patients that have them in order to be permitted to continue working. Follow-up evaluations to make sure that these certifications and trainings are being followed would be required as a good checks and balances to this as well. So the way to test and plan for the implementation of this is that you could start at a local city or a local hospital, a smaller, uh, easier place to implement it, and making this a requirement to see if there's an increase in care for those affected by substance use disorders. A good way to track this is to see if there's an influx in substance use disorder patients at these specific locations, and you can give qualitative interviews to those that are admitted with substance use disorders to see if the change actually was beneficial. And if the experiences of these patients do increase and a lack of stigma is occurring there for the healthcare workers, the project could be expanded on to go into a more statewide or national level. And that's it.